My name is Jackie and I'm from Centerville, Ohio, and I was just wondering about a nerve conduction test. What's involved and is it painful?
Jackie, a nerve conduction test is one of a variety of tests that neurologists use to understand if there is any dysfunction of nerves and/or muscles in the body. The nerve conduction test itself simply involves having an electrical current pass across a nerve and measuring the period of time it takes to go across that nerve and comparing that to normals. Oftentimes, nerve conduction studies are done in conjunction with what's called an EMG or electromyography, which is where small little needles are placed into muscles to determine if their activity is normal or abnormal. In general, they're associated with a minimal amount of discomfort. I wouldn't call them painful.
I'm Dr. Paul Ariano, and I would like to take a minute to discuss an important test used in neurology called an electromyogram. The more common term for this procedure is EMG. Disorders that are typically diagnosed via this procedure include peripheral polyneuropathy, myopathy, pinched nerve roots in the neck and back, as well as more complex neuromuscular disease. In the general public, there is a large misconception that this study is quite painful. People do not like needles, I understand that. The needle we use is extremely small. It is placed into a few select muscles and we record out of the muscle. When done properly, it should not be overly uncomfortable. I took an extra year of training just to learn this procedure specifically, to do it properly and compassionately. If you have any significant concerns about this test or any potential discomfort, you should feel free to contact one of our staff to discuss the details of this procedure in detail prior to your visit with us.
Your physician has ordered an electrodiagnostic study. This study tests the function of nerves and muscles and gives the physician important information regarding your problem. The electrodiagnostic study is an extension of the physical examination, and your examiner may perform several hands-on tests prior to beginning any electrical studies. Nerve conduction studies are usually performed first. The physician will place electrodes in predetermined areas of your arm or leg. A tiny electrical impulse is then delivered, testing the strength of the signal and the time the signal takes to get from one point to the other. You'll feel a small electrical impulse similar to a static shock. EMG or electromyography is usually performed next. A small pin is inserted into the muscles of the arm or leg, sometimes the lower back and neck. The pin essentially serves as a microphone, helping the examiner assess the functioning of the muscle and the supplying signals coming from the nerves and nerve roots to that muscle. These tests will usually take about 45 minutes to an hour and will give your physician complementary information to any previous X-rays, MRI, or CT scans that you may have done. Please remember, do not use lotions or oils prior to your test, and do not wear any jewelry to your examination.
Electromyography, or an EMG test, is the main neurodiagnostic tool used in electrodiagnostic medicine and in clinical neurophysiology. An EMG test is composed of two parts, nerve conduction studies and electromyography. EMGs should be performed by trained physicians in order to establish a correct diagnosis, to evaluate the type and severity of a disorder, and to exclude alternative diagnoses. EMG tests provide information about injured nerve roots, damaged nerves, and muscle disorders, leading to symptoms of numbness, tingling, burning, pain, or weakness. An EMG test is an invaluable diagnostic tool which provides a roadmap for physicians, helping them locate, evaluate, and successfully treat neuromuscular disorders. Before the EMG, patients may continue routine activities such as eating, exercising, and driving. They are required to stop using lotions and creams on their skin for 24 hours prior to an EMG, but they may continue to take any medication. During the first part of the test, electrodes are strategically placed over the tested area, and a small electrical stimulation is applied to the nerves, causing a mild tingling sensation. Using sophisticated digital equipment, nerve and muscle responses are recorded. The rate at which nerves conduct electrical impulses can then be calculated. Disc, ring, or bar electrodes are used to record responses from motor, sensory, and mixed nerves. Frequently used motor nerve studies include median and ulnar nerves when evaluating upper extremity disorders. Tibial and peroneal nerve tests are essential in evaluating common lower extremity conditions. Assessment of sensory fibers may require testing of median, ulnar, and radial nerves in the arms, and sural and superficial peroneal nerves in the legs. In the assessment of more complex disorders such as brachial plexopathies, testing of the medial and lateral antebrachial cutaneous nerve is required, while testing of the saphenous nerve is necessary in the evaluation of femoral nerve disorders. As the EMG test progresses, the examining physician customizes the test according to the recorded responses. Each and every test is tailored to the patient's needs. The second portion of the test requires an insertion of a small disposable needle electrode into the designated muscle, which must be appropriately selected by the examining physician. The tip of the electrodes record muscle activity both at rest and involuntary contractions. Muscle tissue does not normally produce electrical signals during rest. Assessment of the muscle at rest may yield abnormal activity, indicating disruption in the nerve connection to the muscle or muscle inflammation. Patients will next be asked to engage the muscle. The recorded signals, known as motor unit potentials, are then immediately analyzed by the electromyographer. The combination of amplitude, duration, phases, and recruitment patterns may show evidence of myogenic or neurogenic disease. The test can last anywhere from 30 to 60 minutes, depending on the number of limbs tested and the complexity of the problem. As there are no lasting side effects from the test, patients may resume all of their usual activities following the test.
Hello, I'm Nina. I'm with the neurology department here at Hattiesburg Clinic. I'm a neurodiagnostic technician, and I'm here to talk with you today about nerve conduction EMG study. A nerve conduction velocity study measures the electrical activity of your nerve, and the EMG measures the electrical activity of your muscle. They're both ordered by your physician to help with your diagnosis. After checking in for your EMG nerve conduction study, you'll be brought back by a technician and asked to change into a gown. After that, we'll perform the nerve conduction velocity study first and then the EMG. So for the nerve conduction study, we place electrodes on your hand. We'll ask you to put your thumb and pinky together so that we can find your APB muscle and place an electrode on it. It's important during the nerve conduction study to try to remain as still and relaxed as possible. Okay, relax your hand. Next, we take this instrument and stim several places on this nerve. We start out low and work our way up so that you're able to get used to the feeling. We'll do several places on your arm. Sometimes it can be a little uncomfortable, but it's very fast, so tolerable. For this study, there's not a lot of preparation. We just ask that you don't put any lotions or oils on your arms or legs. An EMG is an electromyograph. The EMG is performed by the physician. He takes a small needle and places it in several muscles in either your arm or leg. This can be a little uncomfortable, but it is tolerable. But at any point, if you would like to stop, you can ask your technician or physician. Your test results will be sent to your provider, and they will go over them with you at your follow-up appointment.
Hi, my name is Katie Brosnan. I'm a registered nurse here in Austin, Texas, and today I'm going to talk to you about causes of numbness in fingers. It's good to know that there's a lot of things that can cause numbness in fingers. I'm just going to kind of briefly go through some things that could be causing the numbness, but it's really important if you're having numbness in your fingers and it's over a prolonged period of time, you really need to seek medical attention, because this can be permanent if it's not dealt with immediately. Some of the things that can cause numbness in your fingers is some sort of an injury. A nerve injury, if you hurt your hand, you severed a nerve with a laceration, and that's causing some nerve injury. If you have compression, when you have pins and needles, your arm falls asleep, you're compressing a certain nerve that's creating that effect. So you might have some sort of a compression or compression injury, which is affecting the nerve, and then it's manifesting through numbness in the fingers. Another thing that can be causing numbness is a cervical syndrome. Whether you have an injury with your spine or you have some sort of a debilitating disease which is causing kind of that compression on the nerve and manifesting through the fingers. Multiple sclerosis is often detected through signs and symptoms like this, which is another reason why you really want to go to the doctor. It's not the only sign, but it is an acute sign that there could be something going on. Raynaud's syndrome is very common, where the arteries are narrowed going to the fingers, and so you get the cold and the numbness, usually associated with cold and stress. And if you have diabetes, or you might not be diagnosed but be developing some symptoms of diabetes, it's called diabetic neuropathy, and this is when you're not getting as much blood flow and you're having some nervous or nerve damage to your extremities, which could also be causing numbness in your fingers. So it's really important that you go to the doctor to find out what's going on, especially if this isn't clearing up in a day or two. And those are some things that might cause numbness in your fingers. Today I'm going to talk to you about peripheral neuropathies. Peripheral neuropathies is any pain, numbness, tingling, or burning sensation that are present in your hands, your feet, sometimes your legs. You might also have sharp pain-like symptoms. And these are things that are most commonly brought on by a traumatic injury, by infection, by an exposure to toxins, and most commonly by a secondary effect of diabetes. And so with treating this, you kind of want to know what's the underlying. If it's a traumatic injury, it's an acute episode of peripheral neuropathy, which might resolve itself. If it's not resolving itself, you want to treat the underlying disease. So your diabetes needs to be under control, or if you've had exposure to toxins, you need the right treatment, or an infection, you need the right treatment with that as well. And then if these things are not resolved through those routes, then there are medications that are most commonly used. The most common ones are medications also used for epileptics and for as an antidepressant. So you've got your Neurontin or your Topamax, as well as amitriptyline or Cymbalta. And so these tend to confuse the chemical responses and prevent from that pain from happening. Another is using over-the-counter pain medication. So you might be using ibuprofen, or you might need something a little bit stronger like codeine, which you need a prescription for, or something like a lidocaine patch to stop the pain topically right in that area that you're having the most severe pain. And these are things that are going to be regulated and managed by your physician in the event that your peripheral neuropathies are not under control or being cured over time. So that's just a little bit about peripheral neuropathies.
The Bahamas Neurological Center, established since 1999, the only facility in the Bahamas that offers comprehensive neurological, neurodiagnostic, and neurorehabilitation services at the one local. The first comprehensive neurological clinic in the Bahamas. The only multidisciplinary facility in the Bahamas catering to the English-speaking Caribbean. Our main mission is to provide our local and worldwide customers with qualified medical providers and administrators who can deliver world-class standards of service and products within the Bahamas and Caribbean region while promoting our customers' good health and overall well-being. Rehabilitation services. We utilize an interdisciplinary approach to the management of clients with neurological disorders. Our neuro rehab team comprises of neurologists, nurses, clinical psychologists, physical therapists, and occupational therapists. We treat children and adults with disorders such as cerebral palsy, brachial plexus injuries, developmental delays, learning disorders, attention deficit disorder, autism, epilepsy, spinal cord injuries, Alzheimer's disease, orthopedic injuries, and Parkinson's disease. Physical therapy. Our physiotherapist provides comprehensive assessments and treatment of musculoskeletal injuries. A strong emphasis is placed on active rehabilitation programs which return clients quickly and safely to their pre-entry condition. Each treatment course is specifically designed to meet the individual requirements of each client. Physical therapy treatment options. Some of our options are physical assessments and treatment plans, soft tissue manipulation, joint mobilization, electrical stimulation and microinferential current, therapeutic ultrasound, ergonomic analysis, and patient and caregiver education sessions. Occupational therapy. The goal of our occupational therapist is to help our patients achieve the best optimal function in all aspects of their life, including work and self-care. With the help of our occupational therapists, our patients are able to gain personal independence to help them reintegrate into their environment, for example, work, school, etc. Evaluations. Some of our evaluations are cognitive performance, instrumental activities of daily living, customized treatment plans, cognitive remediation, development of fine motor skills, and recommendation for assistive devices and home modifications. Psychology. The overall goal of the clinical psychologist is to reduce any psychological distress and promote the emotional well-being and overall development of children, parents, adults, and families. The focus is on the patient's behavioral, emotional, and social functioning. Therapy. Some of the areas we deal with are cognitive behavior therapy, depression, anxiety, behavioral modification and management, general counseling, both grief and coping, developmental delays and special needs, and stress management.